Welcome. Thank you all for joining us today. Just give people a couple of minutes to trickle in, and we'll get started in just about a minute. Okay, welcome again, and thanks to those who have just joined. I'm Lindsay Goldman, CEO of Grantmakers in Aging. We are a community of funders mobilizing money and ideas to strengthen policies, programs, and resources for all of us as we age. We create opportunities for funders to connect, collaborate, and co-fund. We help funders who are already investing in aging to fund more strategically, and we help funders who are not funding in aging to identify the intersections of aging and every other funding priority. I'd like to thank the John A. Hartford Foundation for their support of this webinar series. For today's conversation, we are joined by Susan Ryan, CEO of the Center for Innovation at the Greenhouse Project, a nonprofit organization dedicated to building small home alternatives to traditional nursing homes, for an exploration of the ways that grants and other forms of charitable funding are supporting innovative long-term care solutions. Susan will facilitate a conversation with leaders from the Thome Rivertown, a complex in Detroit that some of us will be visiting next month during the annual GIA conference, that offers both community-based and residential care for older adults on Medicaid. In addition to Susan, our panel today includes Roger Myers, CEO of Presbyterian Villages of Michigan, Paul Miller, President of Presbyterian Villages of Michigan Foundation, Mary Naber, CEO of PACE Southeast Michigan, and Wenona Breazeale, guide at the Weinberg greenhouses. Thank you all for being here. We will have time for your questions toward the end of the webinar, so please use the question box in the Zoom platform to share your questions. We are recording today's session, and we will share the recording in the next few days, and we will also be sharing the slides. I am now pleased to turn it over to Susan Ryan to get us started. Susan?
Thank you so much, Lindsay, and I can't tell you what an honor it is to be with each of you. I have to tell you that some of the things that Lindsay said I resonate so greatly with, and that is the idea of collaboration, to really advance ideas and to advance innovation, and to think about the partnerships and the opportunities between funders and between really innovations and initiatives and ideas that really need to be put out there. So it is truly a privilege to be here, and I'm especially honored to be with my colleagues at Thome Rivertown. So I thought what I would do, obviously we're going to share our stories about how transforming and embracing innovation and what that partnership or that collaboration has been with different funders along the way to kind of put these ideas and these innovations out there. So I thought what I would do before I start sharing my slides is to really just kind of set the context a little bit. And I thought it would be important to kind of understand what's the problem we're really trying to solve here and what is the innovation that's addressing that problem. And so I go back, my background is as a nurse, and I've been in long-term care for decades, literally decades. And I can tell you, I remember back in 1987, when the omnibus budget reconciliation, nursing home reform was executed by Congress. It was in 1987. It was in response to a comment made by a senator who referred to nursing homes, get this, as the halfway house between society and the cemetery for the elderly. And so obviously we needed to do something about it. Nursing Home Reform Institute of Medicine studied it. OBRA, Omnibus Budget Reconciliation Act, happened, and nursing home reform began. And we wanted to look at the whole person. But I want to fast forward to 2020. You might remember a thing called the pandemic, and the pandemic rolled through nursing homes like fire through dry grass. And I remember another comment by the assistant lieutenant governor of New York. It was headlines in the New York Times. She referred to nursing homes as death pits, that they were understaffed and they were underfunded. So thinking 1987 to 2020, how good were we? Our good wasn't good enough. And the tweaks that we were thinking about in 87 obviously didn't really get fully made, or they certainly weren't adequate enough to really be able to address the problem. So what do we do? It's another report, the National Academies of Science, Engineering, and Medicine, 600-page report. And once again, they said it's time for nursing home reform, and it's time for us to do something about it. The John A. Hartford Foundation has also funded an initiative called the Moving Forward Coalition, which we're a part of, I'm happy to say, to really support. Now, how do we really do something rather significant? So if we go to the next slide, I'm going to kind of start our conversation and really, once again, try to put those pieces together, try to tell those stories about how grants have been fuel to be able to support and embrace those transformative, innovative ideas and get them rolling somewhere. So let's look specifically at the Greenhouse Project. And I don't know, on the next slide, you can go there. How many of you are familiar with the Greenhouse Project? That previous slide did show you a small house. That is and you can look at my background. I'm in a virtual den of a greenhouse home. They are small homes. Where did it begin? Let me give you the history first, and then we'll kind of unpack what it is. In 2003, as a result of some work that Dr. Bill Thomas had been doing, he had introduced the Eden Alternative and these principles that would bring life and meaning into traditional nursing homes. He thought, I think we need to rethink this. I think we need to figure out what's the ideal environment for those principles to really live, grow, and thrive. So in 2003, he partnered with Methodist Senior Services in Tupelo, Mississippi, to bring the first 4 greenhouse homes ever conceived or built. And as a result of that, on the next slide, the Robert Wood Johnson Foundation very generously, because they believed that this was innovation, this was transformation that was radical and would really yield a paradigm shift to the world of elder care. They funded a $10 million replication initiative from 2005 to 2010. It was really their desire to see that there would be a greenhouse model in all 50 states. And so we began the initiative, the Greenhouse Project team. We were kind of the team that received that funding, going through Capital Impact Partners. And we were there to really work with states to see what we could do to make it happen. Over the years, from 2010 to about 2017, the Robert Wood Johnson gave smaller grants to build a network. They wanted to make sure that the research was done on the model. So there were other grants that really funded research to really dive into the evidence base for it. Finally, in 2017, actually 2016, they really took Greenhouse from the Capital Impact Partners, and they funded that transition into its new home, the Center for Innovation, in which I am the CEO of that. And so when COVID hit, they came back in 2020 and they said, I believe you've got answers that need to get out there. So a smaller grant, a $75,000 grant, was given for us to really talk about our best practices and how we could, what does the greenhouse model and its core values have to tell other nursing home providers. So we did some telementoring, all virtual via Zoom, just like we're doing here with that wonderful 75,000. So where are we today in terms of impact? So on the next slide, I am happy to say that the greenhouse has gone global. We've got 8 homes in Australia, South Australia, that opened last year, and we are over 401 homes. I actually will add another 10 homes to that. We just had some open in Arkansas, some more homes open in Arkansas, so we're at 411. We are in 33 states in the US, and again, the one state, South Australia, there. So think about that seed money, that fuel, if you will, that really catalyzed and really kind of put the Greenhouse Project and this innovation on the map. So let's drill down just a bit to understand a bit more about what the greenhouse model really is. So next slide. What you're looking at is a home for 10 people. This is a home that has 10 private rooms, each of them having their own ensuite shower and bathroom. It is centered around an open concept, a kitchen that's accessible for 24 hours a day. You've got access to the food. It's access to outside. You can see kind of to the left of the screen, there's a gazebo out there between the other home there. This is licensed as skilled nursing. So residents who are there are in need of skilled nursing care. Last time I checked with them, they were about 60% Medicaid, and then about the rest of it was private pay. But to think that this is a model that fits within the Medicaid and Medicare reimbursement structures. So it can be home for life, even when your care needs would require that. On the next slide, lest you think that all greenhouse homes are single family homes, here are just a few examples of homes that have gone vertical. The one over on your right, that is the Leonard Florence Center for Living. I think their homes probably comprise about 22 million of philanthropy. It was a $37 million project. And so when you think about, so what have our partners, our greenhouse partners, as we've worked with providers, what have they done? And you'll hear more about that from Roger Myers and the team at Thome Rivertown. But they said in Boston, our homes are not single family. There's no way we could get 10 homes in the little lot size we have. We need to go up. And since then, there have been other iterations of different architecture and design styles. But at the end of the day, it's a real home. It's what you and I would say, yeah, I could live there. And like I said, when people ask me if my background is my home, I take it as a great compliment because it is a greenhouse home. And it is a home where residents that need skilled nursing care can live in that greenhouse home. On the next slide, I don't want you to think that the greenhouse homes are just about the architecture and the design, and it's just the physical layout. That's one of a three-legged stool. And that second of the three-legged stool is what I call the philosophical culture that is about meaningful life. It really is, if I want somebody to have a meaningful life, I need to see the person. I need to be in relationship with that person. I need to know what gives them meaning, what gives them purpose with each day. Deep knowing relationships. I always say it's all about relationships. Relationships that yield deeply meaningful and purposeful living. And so on the next slide, to really make that happen, in order to have a person-directed culture, in order to have that meaningful life, you need to have a worker that's empowered. Better jobs, better care. And you've got to understand the inextricable link between empowering a workforce to seeing that person, that worker, as intrinsically worthy and valuable, as well as the resident or the person that they're supporting in that home. And so in the greenhouse model, we really work very hard to work with leaders. Another one of my mantras is it's all about leadership. Leaders that really embrace innovation and understand the vital role that an empowered workforce will bring to engender that person-directed culture. On the next slide. Over the years with Greenhouse, to go back to kind of the fuel that keeps us going and keeps us growing, ongoing innovation, and the journey just never ends. We want to keep growing. We want to keep innovating. So in 2018, I believe that the greenhouse model is best practice to support people living with dementia. That having been said, we recognized after some research that 85% of those living in greenhouse homes had mild to severe cognitive impairment. And so with the generous support of a funder, it was a $100,000 investment, we developed the best life memory care approach. It builds upon those core values of a real home, meaningful life, and empowered staff. And we bring principles, the dignity of risk, the power of normal, focus on retained abilities and advocacy. We bring it together. And then the next year, another funding of $100,000, we disseminated it and really got it embedded into our greenhouse education. And we created a standalone memory care approach that has broader application beyond just greenhouse homes. So funders, I am grateful for all that you have done to really bring the fuel to make innovations happen, to fuel transformation that we know is meaningful and will be a part of nursing home reform and that expanded landscape. The CFI's mission, Center for Innovation's mission, is to be the catalyst for person-directed living and empowered cultures in the community of one's choice. And so with that, I'm going to stop sharing the slides and invite my colleagues from Thome Rivertown to join me. Because when I say it's all about leadership, it really, truly is about the exceptional leaders from Thome Rivertown. So Roger Myers, Paul Miller, Mary Naber, and Wenona Breazeale will hopefully join us soon. But I'd like to turn it over to you, Roger, and talk to us a bit about Thome Rivertown. And I remember meeting you way back. I started with Greenhouse in 2008, and I met you in context of greenhouse homes at the village of Redford. So talk about how you got to Thome Rivertown, a little bit about its history.
Thank you, Susan, and thank you, Lindsay, for hosting this webinar. Detroit is very excited that GIA in about a month is going to be having your annual meeting in the Motor City, and you're going to have a great experience. There's lots of things that are going to be happening in conjunction with the conference. One of those things is a site visit to Thome Rivertown. And so if you haven't already registered, you can still do that. I think the tour to Thome Rivertown is almost at capacity. So again, Detroit's excited. We're all excited to have you here in about a month. Yeah, I would talk about our journey. I think the title of this presentation that has the words transformative change is really appropriate. And so when Susan talked about back in 2007 and 8, PVM had heard about what was being done in Tupelo with the first greenhouses. And a few of our team members went down to Tupelo, and they were immediately inspired by what had happened there. In fact, they called me from the airport and they said, you know what? We've got to stop our plans to build a new nursing home. We need to do greenhouses. And that's in fact what we did. Kind of fast forward to probably 10 years, well, not quite 10 years, 4 or 5 years after that, PVM had done a lot of affordable housing in the city of Detroit. We actually started doing affordable housing in the late 70s, and then in the early 90s, we began working in Detroit. And so we had done a lot of affordable housing, but none of that had a continuum. And it wasn't until 2012 that we entered into a partnership with Henry Ford Health and PACE, and you'll hear about more of that. And so as we began to imagine an affordable continuum, so not just the housing, but what would happen in terms of supportive services and care for those individuals as they became frail, needed more help. So we developed this vision of what became Thome Rivertown, and we had been planning to develop it adjacent to one of our affordable housing sites in downtown Detroit in the Brush Park community. And we actually had plans drawn up, and we were proceeding along, and we were talking to the Community Foundation for Southeast Michigan, and we were asked, would it be possible to move the project to a different part of Detroit? And we thought about it, and the reason that they suggested moving it was they had received a significant grant from the Ford Foundation and the Kellogg Foundation to basically target redevelopment in a certain area. And if we could put the next slide up. So here you are. So think about this back in 2009 or 10, and there was this stretch along what's called Jefferson Avenue, where the community foundation wanted to make targeted investments in multiple projects. And so they were very excited about our vision. And so we brought it to this location. They provided a $2 million grant. It was the first grant that made this project possible. This was a former Park Davis manufacturing facility that had been vacant for a long time. Let's go to the next slide. So you'll see it with the next slide. So this was kind of what came out of that. And so it's multiple components. So it's housing. So the building you see on the right hand of the screen is a housing development. The main building in the center, the first floor of that building has a PACE center, large PACE center. And the second, third, and fourth floors of that building have what's called affordable assisted living, or you might say independent living with services. And then in the little building that kind of comes out toward the top, that is where the Harry and Jeanette Weinberg greenhouses are located. There's 2 greenhouses there. So you can, if you could go back the one slide, so the before slide. So from that to the next slide, and this slide really doesn't even do it justice, but it's, you know, an aerial slide. So essentially, partners came together. So not just PVM, but it was Henry Ford Health, because they had the PACE program. They started PACE in the mid 1990s. It became a joint venture in 2012. And actually, this was the location of the first of the centers. You'll hear more about that from Mary. And then we had Breazeale Living Services. Breazeale is what was formerly called United Methodist Retirement Communities. So those 3 nonprofits came together around this vision, executed it, received, and this project was like over $50 million, received about $12 million in philanthropy, but a combination of federal, state, county, city, private investments, philanthropy, 27 different sources of capital to do this development. This development serves about between 500 and 600 people a year. And we are in the process now of replicating this in Flint, just north of Port Huron, Westland, and in Pontiac. And I think with that, I'm going to turn it over to Paul. And Paul's going to talk about the pivotal role of philanthropy. Paul.
Thanks, Roger. And Susan, I don't know if you know that 18 years ago, I was hired, and really my motivation was this. I remember leaving going, there's a new concept that PBM is doing for nursing homes. They're calling it greenhouses. I'm a little confused here, but I can remember being inspired 18 years ago to come aboard to raise money for our first capital campaign at the Village of Redford. So it's very close to my heart, this project. But speaking of that $12 million that we raised in philanthropy for Thome Rivertown, I would love to say it came roaring in and everyone was inspired and it was just a love fest and the money just flowed. Well, the community foundation was just, as Roger said, they were pivotal in bringing this from an idea to fruition in directing us over to the campus where we're at now. But they also really, Roger, gave us some sage advice. And we were beating the drum of, oh my gosh, we have older adults, they need more care. We need it on one campus if you're lower income. And it was really, to some degree, they had to throw out kind of the red flag, if I use a NFL football term, they time out here. They said, we get all that, but you need to focus on what the economic impact will be in the surrounding community. And if we harken back to 08, 09, 010, the country was in the throes of what they call the Great Recession, and Detroit was really at the epicenter of it. And so being able to speak the language and the messaging, we needed to be fluid and change our messaging and realize that doesn't mean this isn't important what we're doing. We're here because it is so important, but we needed to be flexible in our messaging and pivot. And what we ended up doing is now a common practice as we do capital projects is develop an economic impact study. So we paid for an economic impact study to look at the value of Thome Rivertown, of course, in construction jobs, but also in the jobs, a lot of them that are produced by PACE, and what the footprint will be left from this project. Once we changed that messaging, it wasn't like we opened a faucet and it started flowing, but we could talk to, people that weren't in aging, that said, oh, I don't know if we want to fund capital, or those in aging. And we married those all together, and that's how the $12 million of funding started. And we're grateful for other individuals that were pivotal along the way, which is, we mentioned the Community Foundation, Marion Nolan, the past CEO, Elizabeth Sullivan, who was a program officer at Kresge, then at the Community Foundation. Roger, I remember her coming out when Weinberg came to visit and really helped out a lot. Tim Wintermute introducing us to the Thome Fund. And, I'm just trying to look at others here. Aaron Siebert, Michael Marcus, George Thorne from Thome. They all gravitated to this concept. And they weren't gravitating to it because it was just, we were doing a low-income housing site or a low for PACE. It was that it was all integrated on one campus. That's what spoke to those in aging. And then the folks that weren't in aging, they loved the jobs that were being produced. So I guess the theme to this is you have to read your market, and you need to adjust and adjust quickly, because it wasn't like we wanted to sit by idly and let this project be 6-7 years in the making. We wanted to get going on it. I would also say we were grateful to have a relationship with George Thorne and Sri Laku Raju from the Thome Foundation. And something that I wish was more practiced by the foundation world is we proposed developing a foundation developing an endowment that Thome could fund for Thome Rivertown. And it was $1.5 million, because we said, we don't know where the future is going to go with this, but we want to have money at the ready, which would be $75,000 annually from this fund to adjust to the changing way that we care for older adults moving forward. And it's really helped us get over a few humps on making Thome Rivertown sustainable. Because the whole idea is when you get funding, how can you sustain it? That's a tough question. Because when we're serving a clientele with this type of margin, how do we make it sustainable? Well, we have to build a war chest of money to use in the future. So I think that was a key element to getting Thome to buy into funding an endowment. I think that probably says it well.
So do you want to tell the story?
Oh,
Paul?
yes.
Yeah, let's show the slide because I think stories really shape and tell kind of why we do what we do.
Yeah, I've heard that people can only retain about 30% of the spoken word, but you say a story,
Yeah, exactly.
It's like at 60-70%. So this is Mrs. Jones, and she is, we did a tour early on at Thome Rivertown. The man here is Tom Kimball. He's a foundation board member, but also the past president of the General Motors Foundation, and at the time was the current president of the General Motors Foundation, Vivian Picard. And we had hosted Vivian almost as somewhat of a dress rehearsal for Weinberg coming. And we had heard, we had the very first resident at Thome Rivertown was Mrs. Jones. So Roger and I brought them out, and I can remember asking Mrs. Jones, saying, so how are things going? Good. So how are you doing? Fine. And I'm like, oh my gosh, we are going to die here. She is not opening up. So she had a beautiful room with pictures of her family. And I just said, so where did you come from before? And she said, well, I thought I was praying that I would die. And now you can hear a pin drop. What? So where I was before was a high-rise building. The elevator didn't work. And as you can see, I have limited mobility in this scooter. And there was a fire above my roof. The apartment above me was cooking methamphetamine and caught the apartment on fire. And there I'm sitting there. My family hadn't visited me in years because they didn't like where I lived. And so I was all alone, isolated. And there the apartment above me was on fire from a drug dealer. And she said, Lord, take me. I don't have any worth left in this life. Fast forward 2 months later, she's at Thome Rivertown, a beautiful room. Her family has come to see her. Remember, Roger, she kept talking about her family, and she was really ready to become the resident council president of this area when they came in. And she, like, all of a sudden came out of her shell, which is these one word answers. And it really spoke to me and to others what this meant to people's lives.
Well, it's a beautiful story. And I can tell you from personal experience, having been to Thome Rivertown, there are so many conversations I've had, certainly with many of the residents that live there, and how it has been a game changer, how it really, truly has changed their life. So, Mary, I'm going to transition to you and just ask that, PACE is a pretty significant part of this continuum. And when I think about it from a sustainability perspective and what it has done to the community, it's such a vital ingredient. So talk to us about the role that PACE plays in the Thome Rivertown community.
Okay, first of all, it's my pleasure to be here. Thank you. I want to thank all the grant makers for investing in aging facilities, aging programs like PACE, because it's made a huge difference for us to continue to grow and serve. PACE, as many of you know, stands for Program of All-Inclusive Care for the Elderly. It's a very unique care model because it's regulated by Medicare and partnered with Medicaid, the state. And our mission is to care for nursing home eligible, low-income seniors who want to remain independent in the community. So how I got into this story is I worked for a health system for many, many years, and then I took on the role of PACE CEO, PACE Southeast Michigan. And we currently, at the time, we were caring for just about 250 people. The partnership between Henry Ford and PVM was early on, and it was around 2015 that the conversation around the greenhouse had started. It was the last segment of this campus. And so I was brought in to talk to the COO of PVM at the time about the fact that it was going to be a nursing home and it was going to have this new concept of greenhouse. So I learned about the greenhouse model and principles. I'm going to call them the principles of the greenhouse. And I thought, this is so aligned with PACE and the PACE culture and philosophy that it makes such a wonderful partnership potential. So her name was Joanne Robinson. And as we talked through it, I said, well, why does it have to be a nursing home? And so that was part of my question. And sometimes when you're less knowledgeable about something, you can ask the stupid questions and create something new and different. And that's exactly what happened. I knew that in PACE, about 5% of the PACE participants end up in a nursing home. And because we're the health plan and the comprehensive care provider, we're fully at risk for all the cost of care. So if they go to the nursing home, we're paying for that. So we have people in the nursing home. And I thought, wouldn't it be beautiful if we could create this setting in the Rivertown campus as an extension of the PACE program and have them actually live there, and we could pay for each room and remove people from the nursing home and put them in this new, lovely setting that gives them the dignity of a private room with their private bath and common living for socialization. And it's lower cost for PACE. It was a win-win. So we talked through that. We ended up developing it as a home for the aged, and that is what it is today. And it's been in existence. I think we opened in 2016. We are incented to make sure that every room is full all the time because we're paying for every room every day. And that works now we're serving over 1,900 participants. out of currently 8 centers, soon to be 9, which the 9th will be at Westland. And this model is something we've tried to replicate in different ways because there is such a challenge for finding the right kind of environment as seniors age and they have chronic illness already, and they need more supportive services, and they don't want to be in an institution. And so this has been our challenge, is how do we duplicate these kind of environments and make it provide something that is where we can provide the care and they can live with dignity and respect in the kind of environment and afford it.
I think that's what's so powerful, the accessibility, the affordability, and the quality of life experiences. And talking to the PACE participants that are living in those greenhouse homes, their stories were simply amazing. Roger, I wonder if you could talk just a bit. Go ahead.
No, you go ahead with your question, and I was gonna.
Yeah, I wanted you to talk about dying before our time.
Yeah, that's what I was gonna reference.
Perfect.
Yeah.
Okay.
Yeah. Can we go back to the picture of Mrs. Jones? Because I think if there's a way to do that. So back in the 90s, I think it was in the late 90s, the Detroit Area Agency on Aging, in conjunction with Wayne State University and a number of other organizations, they commissioned this study that ultimately was named Dying Before Their Time. And what the study, and actually, if you go to the Detroit Area Agency on Aging's website, that study is on the website, and they've had now 2 subsequent editions of that study. And what the study, what it kind of profiled was that if you were an older person and you lived in zip codes that happened to be in the city of Detroit, like where Mrs. Jones lived, your mortality rate, your life expectancy was more than 10 years less than a senior that was in the next zip code over. I mean, literally just in the next zip code over. And so the study was like, and again, people, I think they maybe intuitively knew this, but when they looked at the data, it was just overwhelming. And it was around access to healthcare and affordability, and it related to primary care, it related to food deserts, it related to social, and back when the study came out, I don't even think they were talking about social determinants of health, but there were hundreds of thousands of people like Mrs. Jones that they were dying before their time, and people weren't aware of it. Now, unfortunately, when the second study was done and the third study was done, in spite of the attention that was given to it, and in spite of things that, like Thome Rivertown, which has been very helpful, but again, it's not to scale, the basic data didn't change. So people still, if you live in a certain zip code, you're going to die a lot sooner than if you lived one zip code over. So I give a lot of credit for the Detroit Area Agency on doing that, but there's so much more that needs to be done. And I think the results in Detroit are mirrored in virtually every other urban area. So this is not something that's unique to Detroit. And I guess I would just say one other thing about PACE. So the program that Mary and her team leads is now like the 5th or 6th largest PACE program in the country. So, it went from, serving 200 people to now almost 2,000. And the goal is over the next few years to get to, over 3,000 or maybe 4,000, because the need is huge. And we're still scratching the surface.
Yes.
So I'm going to ask one quick question to you, Roger. What makes Thome Rivertown so unique? I know when we were talking the other day, you talked a lot about how unique and why it's unique.
Well, it's unique for several reasons, but I think the access to a continuum, so that if you live in an apartment, and what we find in many of our apartment developments is people are really happy there, and the thing that they fear and that they don't want to have happen is to have to move out. Well, now at Thome Rivertown, with the support of PACE, with affordable assisted living, like literally right across the parking lot, that whole community is their home. So that fear of having to leave is greatly diminished. And so I think the collaboration as well. Mary's got to add on to that, Mary.
Yeah, I was just going to add that I think also, I mean, there's a community culture
Yes.
that exists on that campus. And all of the staff play a part in that. And the beautiful thing is our care team goes into their home and provides the care that they need. They come to the center, and they all know one another, right? So there's a socialization that exists. There is support that is there right on site. And that to me is also something many of them have never experienced in their life. It's a higher quality of life. It improves the quality of their life. We're not going to cure many of them, but we are going to improve the quality of their life. And that's what we've witnessed. We've witnessed it.
Susan, several of the foundations told us right at the beginning that beyond the vision and what we were doing to transform aging, they were motivated by the fact that there were 3 fairly sizable nonprofits that were behind this, and that the foundations wanted to make sure that these organizations, Henry Ford, Breazeale, and PVM, were committed to work together, not just to say, well, we're doing this and in a year or two we'll evaluate it, but for the long haul. And each of those organizations, I mean, Henry Ford's over 100 years old. Breazeale's over 100 years old. PVM's celebrating its 80th anniversary next year. So these were, very strong, reputable organizations. But if it was just one of them that was doing it, I don't think we would have gotten the kind of investment that we did.
Well, that's the collaboration C, and the community, I think, being the other one. So I'm going to invite Lindsay back on just to see what questions have popped into potentially the chat or the Q&A box to make sure we get those addressed.
Thank you all so much. That was just such an interesting discussion. I've always been inspired by the greenhouse model. And I think, hearing you talk about the intersections between aging, economic development, and long-term care, it's just a really powerful example that is so important for people to recognize. So one question that has come up, and I'm also very curious about this as well. So, you have the track record, you have some pretty impressive outcomes, clearly demonstrated impact. This is clearly more aligned with how people want to live and age, right? Which is, and the realities of we age between settings and environments. So if this is what people want, what at this point in your trajectory are the biggest barriers to replicating this in other places?
Roger, do you want to?
No, I think there's several. I think the fact that and that's why we've had so many people come and visit Thome Rivertown is because people hear about it and then they want to see it. We had such great alignment, not only between the nonprofits that were involved, but between the governmental agencies and the Area Agency on Aging and the Michigan State Housing Development Authority and the Michigan Department of Health and Human Services. So there was a lot of alignment in that regard, kind of from a public policy and a funding standpoint. There were still detractors that would say, you know, you can't do it. You can't do it for a low income population. Keep in mind, that's basically virtually everybody that lives at Thome Rivertown is low to moderate income. I mean, I think essentially they're all receiving Medicaid. And so I think it breaks people's views, because so many people have thought, well, if you're frail and you're older and you don't have a lot of resources, so where do they end up going? They go into a nursing home because they have no other options. This is a terrible reason. So I think it's getting the collaboration, getting the alignment, getting the regulatory setting. Like I remember, and Susan's heard this many times with organizations from around the country, when we were doing the getting the approval for the Weinberg greenhouses, the fire marshals said, well, we're not going to approve this open dining kitchen area because we need to have special walls put up. And we said, no, you got to understand, this is the way the greenhouses have worked. And we fought that battle in our first greenhouses, but we had to fight it again, and we're successful. And I think the biggest thing is having a determination to see it through, because it's not easy. You couldn't say, well, here's the playbook, let's just go do it. It's going to take a 12-month development period, because it took a long time. And as Mary said, the greenhouse was the last piece to put there. And that didn't start until like 3 years after the first part was done. So I think it's having the commitment and the wherewithal and the willingness to take risks, because we were all taking risks. I don't know, Paul and Mary may have some other things to add to that answer.
I would just add that from a funding perspective of keeping the sustainability of the greenhouse going, it requires, at least if it's in partnership with PACE, and some PACE programs are very small. They don't have the resources to be able to pay for these kind of rooms. And yet it's still it's expensive, but it's less than a nursing home. So to me, the barrier is, how do we get out of our mindset of nursing homes as the answer for people who are low income and even non-low income, right? Because, Medicare only with chronic illness, eventually that's where they end up as well. And so how do we develop a new model for, I'm an aging person, I want to be able to have other options. And this to me allows that other option. But the part of the barrier is what the infrastructure has been, where the money goes currently, right? That's the barrier, current state.
Absolutely.
And mindset. I think you said mindset, I think, is huge. Ageism, the stigmas, the stereotypes that we think and believe they should have, what our system has perpetuated, where funding has flowed. And that has not been to support these types of innovative programs. And the last thing I'll say is, Roger, it is bold, courageous leadership that will really kind of persist through the challenges. It's not easy. This isn't easy work. It's challenging, but it's the right thing to do. And it's the bold, courageous leaders who persist.
Well, thank you all for embracing the risk, which clearly has paid off. Okay, a bit of a clarifying question. How do people pay rent and living expenses? Is this truly affordable?
Yep. It's absolutely truly affordable. So the one housing development was financed through the HUD 202 program, which, in addition to the capital to build a building, provided for subsidized rent. So all the people in that building, they pay 30% of their adjusted income. Again, and it's often very low. And then the affordable assisted living, the 80 apartments above the PACE Center, all but 5 of those are subsidized through the Detroit Housing Commission and the Michigan State Housing Development Authority. So they have project-based rental subsidies for that. They also they've either enrolled in PACE or they have enrolled in the Medicaid waiver program. So the waiver and or PACE pays for care and meals and all of that. So truly, you have somebody living in affordable assisted living, getting their housing, getting 3 meals a day, getting care, and maybe spending $300 or $400 or even less dollars a month. It's amazing.
And I would just add, in the greenhouse where we are paying for the rooms, we collect the rent they can afford. So they pay the rent and we provide the care. That's how PACE model works. We're obligated to provide the care and they pay their own rent minus their spending.
Thank you. That is a helpful clarification. Let's stick with the housing topic. Tiny homes. Have any greenhouses experimented with tiny homes, and what has that experience been like?
So they've not for the residents themselves, but there is a workforce housing project that has incorporated some tiny homes in Washington State. And again, funding grants had provided it. Workforce housing was a challenge, finding affordable housing for the workforce. And so they kind of said, we can support some tiny houses. And so for workforce, they have tried it. We've not done it with the residents though yet.
Mary's got a good example with the container homes.
Wonderful. Yeah, please.
Yeah, so it's not tiny homes, but it's similar model. We are partnering with a housing developer that showed us container homes, and he has property. So we are expanding out container homes so that our participants will have their own bedroom, their own bath in one container home. They'll have a common living space. We're going to put 21 container homes on the property. We'll provide the care via golf cart, whatever it might be. And so they'll have a community where they live. They'll all be PACE participants. They can all afford the rent, and because of the type of home it is, and we'll provide the care. We think this could be really an answer to how to provide some affordable care as people need more supportive environments.
And Mary, it's literally a shipping container.
Literally a shipping container.
Right.
And they kind of fab it, they bundle them up together. So these will be double containers, the ones that we're exploring and doing. And actually the city just gave the approval to go. So we're very excited about it. And if it works, we'll probably do another neighborhood out in another area where we have need.
Can a container be wheelchair accessible?
It is wheelchair accessible. They're ramping them slowly, right? They're going to ramp them. They look like a home. They have windows in them. They have little patio areas. It's amazing. They're lovely.
That is very exciting. We have a number of people from area agencies on aging on the call, and a few questions have come in about opportunities for greenhouses to partner with AAAs. Are we seeing that anywhere? How is it working? People doing that?
Yeah, I think that we always consider them a stakeholder, and we are to that collaboration. I think it's really important to involve the AAAs, and we certainly have used them as advocates for supporting a project in a certain area, really wanting to make sure that they're on board and that they're supporting what we're doing. So that it's a pretty common thing. And some states are more active than others.
The affordable assisted living would not have been feasible without the Medicaid waiver that came through the Detroit Area Agency on Aging. I mean, that was huge. And I know that's not the greenhouses, but I think depending upon the kind of the innovative spirit, there's not a reason why an area agency couldn't do it. I think about the area agency in Toledo that Billy Johnson was the head of it for so long. I mean, they did amazing. I mean, they did housing developments. They did work with the VA. They were going to do PACE. I think as creative as an area agency wants to be, there's no reason that they couldn't do greenhouses.
Roger, I think about Lake Huron Woods. Maybe you want to touch on that with Sunrise Pace and the AAA 7 up in.
Oh, yeah. That's a good point. Yeah. So the Area Agency on Aging in what's called Region 7, they wanted to get involved with PACE. And so they created a new PACE program in the Port Huron area and built the PACE Center on our campus. And so it was an area agency that did it.
It's following that Thome model, right? You know, which is our those 4 sites that Roger referenced that we're expanding more Thome Rivertowns at other campuses. That's one of them, and it's crucial to have a PACE center right on campus, and that's collaboration. And I was there yesterday, and it's a great facility.
And in that case, the Port Huron Housing Commission is also a part of that. So what I would encourage the area agencies that are on this webinar is that if they started talking to their local housing authority or housing commission and maybe another, aging services organization, they might be able to put together the right partners and do it.
Love it.
Okay, our last question is, are these all single units, or do some of them allow for 2 people to live together?
We definitely want to make provision for people that want to live together to be able to live together. So we have couples, whether it's same sex or husband, wife, whatever it is, that have chosen that they want to live together. They're all structured as private rooms. However, we want to make sure that, they can be in one room together and maybe have their living space in another room. It's always an important part of the discussion when we're developing the homes.
And I think all the apartments, Mary, like all the apartments above the PACE Center and the ones in the housing, they all are available to have couples living together.
Yes, yeah. In fact, we have actually 2 married couples that live in an environment together. Sometimes they don't want to be in the same bedroom.
Exactly.
So you need the 2-bedroom room,
Yeah.
but it works. In some of them, we use the living room as the bedroom and then the bedroom as the second bedroom. So it remains affordable. That's.
Would a child live there?
No.
If they were a caregiver, but you're talking about a younger child.
Under
Yeah,
age of 18.
I'm talking about a younger child, maybe living with a grandparent, or an adult child living with an older parent.
An adult child, I think we would be open to considering that. Certainly if they were a caregiver, then they'd have every right to do that. But I think we'd want to evaluate that. And we're very supportive of grand families and grandparents raising grandchildren. We're just not doing it at the Thome Rivertown campus. And Mary, you've had some PACE participants get married, right?
Yes. So if there were a family member or a caregiver type, they would have to do private pay to be able to live there. That could not be, supported by PACE. It's just an important distinction.
Thank you. Well, I would love to continue this conversation for another hour, but unfortunately we are out of time. So I really want to thank Susan, Roger, Mary, and Paul for being with us today. I want to thank the John A. Hartford Foundation for supporting this webinar. As a reminder, we'll be making the recording available as well as the slides. We have lots of upcoming programs, both virtual and in person in Detroit. You can see the actual Thome Rivertowns if you come next month. Please follow us on social channels and please complete the survey that will appear on your screen. It really helps us to inform future programming. Thank you all so much and be well.
Thank you for
Have a great day.